Acupuncture is about 2,500 years old, and we've been using the ear as a microsystem pretty much that entire time. And what they are is tiny little seeds on an adhesive that stick onto the ear that then you press on an acupoint on the ear to activate the wellness in the body, kind of self-healing mechanisms.
In terms of clinical challenges in dentistry, pain control is just hard for all of us clinicians. It's not fun for patients to have a choice between basically opioids and anti-inflammatories. Those are our two big, broad choices. And if people can't tolerate one or the other or both of those things, then we really just don't have a whole lot of options. But there's very solid science for pain control in dentistry.
So this particular spot right here is known as the command point of the head and face. And so it's one of the best points for treating headaches of all kinds. And I recommend to my patients that they massage that place with their thumb and just give themselves a little pressure point. And you can do it even if the headache is on the right side, you can do it on the right hand or on the left hand. And it's a wonderful place to just kind of help to control that headache and get the chi, we call it, to go down on your body.
You also brought some other things because there's different ways that we can incorporate foods into our diets to make us feel better, right?
Absolutely.
What did you bring in?
I brought some anti-inflammatory foods. Many of the issues that women are faced with, not just with insomnia, but also PMS and lots of other kinds of specific gynecological sorts of issues, are caused by inflammation. And so even though we crave those really inflammatory foods, that live in the middle of the grocery store.
The sugar,
Exactly.
the salty snacks,
Exactly.
guilty as charged.
Exactly. What is more helpful is to pick something that's anti-inflammatory.
What kind of seed is it?
This one is a Vicaria seed. So it's a little seed that's a little bit bigger than a mustard seed.
Okay.
And you can see how the needle is a little bit more flat, and then the seed sticks out a little bit more. And then we also can use like larger needles and things like that, but obviously we're not going to send you home with needles in your ear. Right.
So how long do you keep those in her ear?
These can stay in for several weeks at a time. The adhesive is really great. It's kind of like a Post-it note.
Okay.
It sticks whenever you want it to stick, but then you can easily peel it off. And even if you use the needles, they're so small that they can just go right in the trash.
Are there other strategies that you would recommend for us for self-care?
Yeah, along the same lines of drinking water, you really should eat some food. Your body needs food in order to be able to keep your energy up. So it's not about even just focus and concentration and that kind of thing. If you're not putting energy into the system, you're not going to be able to get energy out.
Now I know with traditional acupuncture, placement is different for different things. So where you put these two, what is each one technically doing?
Well, we weren't going to go into any kind of like HIPAA violation on the air.
Gotcha.
So I was just kind of picking some spots as a demo.
Okay.
But if I were doing this for you in clinic, then I would use this little probe and push around on your ear and find some tender spots.
Got it.
Which mean that the vagus nerve that has a stimulus, this big nerve that comes right off your brain, is kind of like your big rest and digest nerve. And so we use those vagal afferents to identify tender places, and then that's where we place the needles or the seeds.